Okay, our next speaker is Lily Xu, who will talk on robust planning over restless groups, engagement interventions for a large-scale maternal telehealth program.
Thanks so much, Phaedra, and thank you again to all the organizers. My name is Lily Xu, and I'm a PhD student at Harvard, and I'm very happy to be able to present this joint work with co-first authors Shresth and Killian and Arpita Biswas, also at Harvard, and many other collaborators listed here from our group at Harvard, the Google Research India team, and also our collaborators at Armon, which is an NGO based in India. No, now it's on. Okay, so our motivating challenge here is that of maternal and child health care. So maternal mortality is unfortunately a very critical problem worldwide, and particularly bad in India, where one woman dies in childbirth every 20 minutes, and 4 out of 10 children are born either too short or too thin. If we look at the rates of maternal mortality, which is defined by a mother that's either dying in childbirth or during pregnancy, during childbirth, or 42 days after giving birth, the rates of maternal mortality in India are twice that of the UN Sustainable Development Goal target of 70 per 100,000 live births, and orders of magnitude higher than that of the US or Western Europe. So it's a particular challenge in India. Fortunately and tragically, many of those deaths are preventable if only the mothers had information about necessary preventative health measures and also access to timely care. So Dr. Aparna Hegde, our collaborator and founder of Armon, points out that pregnancy is not a disease, childhood is not an ailment, and dying due to a natural life event is not acceptable. So Armon was founded by Dr. Hegde in order to connect mothers with this critical preventative health information to reduce these rates of maternal mortality in India. And the approach that Armon has taken for doing so, one of their many programs, is M-Mitra, which is a mobile health intervention program. And M-Mitra stands for Mobile Friend. So the way that M-Mitra works is that it will enroll mothers once they are pregnant and send them specialized health care information from 6 weeks after pregnancy up until 1 year after delivery of the child. And these messages will come twice a week. And each of them is an automated 2-minute long recording that shares information about what's happening with the fetus at that stage of pregnancy, reminders to make sure that they're making doctor's appointments, information about the importance of taking supplements such as calcium and iron, and all sorts of information throughout the course of pregnancy in either Hindi or whatever language that they speak. And M-Mitra is a very, very large-scale program with huge impact. So they have over 2.6 million mothers that are enrolled in this program, and an independent randomized control trial on over 2,000 mothers showed immense benefits in maternal health outcomes, such as improved number of visits to the doctor and taking more rest during pregnancy, for example. Okay. However, a critical challenge that Armon faces is that many women stop engaging in the M-Mitra program. So they've found that around 3 months after enrolling in the program, around 40% of mothers stop listening to these calls and therefore are missing these critical life-saving health information. So Armon's approach for improving engagement is to to have healthcare workers make individualized service calls to these mothers to emphasize the importance of engaging with these calls, and then also just provide that kind of individualized care and check-in. But unfortunately, there are only so many healthcare workers, and there are many, many mothers enrolled in Armon's program. So the challenge is to figure out who to call at a given week based on the information that we have about the mother's current engagement status. So this is where we're bringing algorithms to help intervene and assist Armon with their planning process. And the way that we go about this intervention planning problem is using a restless multi-arm bandit model. And the way that this model works is we consider for each individual mother whether they are engaging with the program, whether they have been receiving these and picking up and listening to these calls over the past week, or whether they're not engaging in the program. So this is a binary state. Either the mother is in a state of 0 or 1. And from week to week, this mother has some behavioral probability of transitioning from one state to another state, going from engaging to not engaging with these calls. So we model this behavior as a Markov decision process governed by some transition probabilities that are unique to that mother, which are these parameters P and Q in this model. Okay. What's significant, though, is that the behavior of the mother actually depends on our action. So if we don't call a mother in a given week and just have her take her normal behavior, then she has some probability of going from engaging to not engaging and vice versa. But if we actually provide a service call to that mother, her likelihood for being in the engaging state in the following week is higher. So there is a separate Markov decision process that governs that behavior of the mother, and the transition probabilities of staying in the green good engaging state is higher when we call. So we want to figure out who we should call to maximize the number of mothers who are overall engaging. So the action that we take in this restless bandit approach is to determine what subset K of the N mothers enrolled in this program should we call in a given week, with the goal of maximizing the impact of our interventions across the enrolled mothers by maximizing the total amount of engagement with these calls across the course of the program. But unfortunately, in this setting of maternal health in Arman, in India, there are many real-world challenges that inhibit us from using traditional multi-arm bandit or existing multi-arm bandit techniques. So one of them is scale, because Arman is fortunate to be working with a large number of mothers, but for a specific cohort of mothers, we can think of 50,000 as a reasonable number. Existing multi-arm bandit, or existing restless bandit approaches don't apply because we have this very large action space, and we have to do planning over a long horizon. So the traditional approach of using a widow index policy is known to be p-space hard to compute. So when we get to numbers like 50,000, we really cannot use those approaches. A second challenge that we have is that we don't have a perfect model of the environment. So we don't know exactly how the mother is going to be engaged in this program. And specifically in this Markov decision process that we have, we don't know the exact transition probabilities P and Q. So it's very hard for us to know a precise value, such as the value of P is 0.632, for example. But it is much more reasonable that we might have some kind of uncertainty over what that transition probability is, and then that will create a reasonable confidence interval bound, such as between 0.6 and 0.7 for this transition probability. So these are the two challenges that we think about. One is interval uncertainty that we use to model our environment behavior, and the second is that of scale. So now I'll talk about how we're actually implementing this method. So the approach that we're considering here is extending restless bandits to the setting of having groups of mothers instead of this very large number of 50,000, and also doing robust planning. So first, to enable scale, we cluster the mothers into groups by using their demographic information, which we have access to, and also their historical engagement patterns, to map mothers who have similar backgrounds and similar engagement into groups that we think will all have kind of similar transition probabilities within some interval. And then we do our restless bandit planning at the group level, so reducing our state space and action space to several tens of thousands to just a few hundred, which then becomes tractable. But then when we actually decide on a policy to take, we act at the individual level. So therefore, going back to the process of thinking what actions we should take for each mother specifically. And then to address uncertainty, we do robust planning with respect to a minimax regret criterion that I'll introduce briefly. Okay. And overall, our goal is to learn some policy, which we denote pi, that minimizes our maximum regret for these unknown sets of environment parameters, omega, which are the transition probabilities. So the way that robust planning with min-max regret looks like is we have our reward, which is this discounted cumulative reward for enacting our policy for a specific instantiation of these transition parameters omega. And we compare that to the reward that of an optimal policy pi star if omega were perfectly known. So then we have this reward of the optimal policy, and the difference between these two values is our notion of regret. So what we want to think about is for any instantiation omega within this uncertainty space, what is the maximum regret we might incur for a fixed policy pi? And then what we want to do is find a policy pi that minimizes our maximum total regret value. So this is our minimax regret objective, and this is what enables us to do robust planning with this closed uncertainty space. Unfortunately, this is not a straightforward objective to optimize. So our transition probabilities omega are continuous, so there are an infinite number of possibilities for that value, or those sets of values. And then our policy pi, which maps a state to action, is exponential in size because we have to choose some k of n arms, and then there are multiple states, multiple actions that we can take. So what to do here? The way that we take this objective and make it tractable is by using an iterative approach to solve for the maximum and the minimizing objectives separately by using a framework called Double Oracle, introduced by McMahon et al. In 2003. And if we look at each component of this objective, first of all, thinking about maximizing reward. So we take a two-agent approach to do this iterative learning process. So our adversary is the agent that is trying to maximize regret by picking some transition probabilities omega that makes it as bad as possible for a certain policy pi. And then we have our planner, the Armand team, which is trying to learn a policy pi which will minimize regret with respect to a fixed environment parameters omega. So then these two approaches independently are tractable, and now what we want to do is put them together in a way that actually optimizes the overall objective. So our approach we call GROUPS, which stands for Group Restless Bandit Oracles for Uncertainty Robust Planning at Scale. And the core components of GROUPS are the instantiation of these two oracles, the planner oracle and the adversary oracle. So the planner takes in some fixed environment parameters omega and then outputs a best response policy pi. And then the adversary takes as input some policy pi and outputs a set of parameters that will maximize regret for that policy. And then the way that we take this and make and solve for our overall minimax objective is by treating this problem as a two-player zero-sum game. So across the columns, we have our adversary, and across the rows, we have our planner. So we start with the adversary just picking a random set of environment parameters, and then our planner will best respond to those parameters. And then the value of this set of actions in the game is our regret. So then we iterate back and forth, maintaining a finite strategy space for each of the adversary and the planner, and then incrementally grow this strategy space one by one until we converge to an optimal policy. So then, in response to pi 1, the adversary will respond with omega 2, new parameters. The planner then responds again, and we continue iteratively filling out this regret matrix until we converge, where in the best response, it becomes some strategy that we already have. And we have past results that show that this is guaranteed to converge in a finite number of time steps. Okay. So at a very high level, the way that we instantiate both the planner and the adversary oracle are as follows. So for the planner oracle, we introduce a notion that we call widow index regret, which takes our combinatorial action space and decomposes regret across each group individually to overcome reliance on statefulness, because past work in robust planning for restless bandits use reinforcement learning, which require that we know the specific state of each individual. But when we're planning at this like abstracted group level, we don't know what the state of an individual is. And then for the adversary oracle, we introduce a quadratic program that will solve for this, this objective of maximizing regret by manipulating the transition probabilities to maximize what's known as the Whittle index of the actions that the policy pi would take, and then maximizing the Whittle index of the actions that it would not take, which recreates this notion of regret. We also have theoretical results that prove that our approach, which prove that the worst case regret incurred when planning at this abstracted group level is equal to that of the worst case regret from planning over individual arms. So even though we're taking these 50,000 mothers and then bringing them down to a few hundred groups, we are able to achieve scale up without incurring extra regret. And finally, we use real data from Arman to evaluate our approach empirically. So we show that our group's framework, it reduces empirical maximum regret by up to 50% compared to existing non-robust baselines for restless bandit planning. What I'm visualizing here is the performance of groups, which is blue, in terms of regret compared to those baselines. And lower regret is better here. And the way that we can interpret regret in this setting is by thinking of it as reducing regret means that we're reducing the maximum number of preventable missed calls, like calls that if we had acted on, we could have prevented that mother from disengaging in the program. And a caveat is that this is discounted over the time horizon that we're considering. So to close this off, I just want to bring this work and ground it in the goals of EAAMO, which are to bridge research and practice. So a few core components of this work are that we have really established long-term partnerships that have been built across many years, across NGOs, so Arman, government. Arman works very closely with 20 states across the country of India. Academia, so our group at Harvard, and also industry through the Google Research India Lab. We also provide close technical support by first communicating and working closely to translate our academic and computational approaches into language and approaches that these non-technical audiences would understand. And also the Google Research India team, for example, actually implements all the software and to make it possible for Arman to run directly. This line of work is a multi-stage set of academic results. So I'm listing out here the set of papers that have emerged from our research group so far that is specifically focused on this Arman problem setting. So I really want to emphasize here that these kinds of real-world collaborations don't have to just result in one work, but rather it could be this iterative process where you're trying to start with simple approaches, understand what's feasible, and then improve and increment over time. And lastly, I want to emphasize that it is very, very important to step in the field and really see what it's like on the ground. So along with having weekly calls with the folks at Arman, many members of our team have actually been on the ground in India, visited the mothers who are enrolled in EMITRA, and also held workshops with the folks at Arman. Okay, so that's what I have to share. I want to close by thanking all of the folks at Arman, from community health workers to staff to researchers and doctors who are supporting mothers and children on the ground. Thank you so much.
We have time for one question, maybe. Yes.
Thank you for that talk. It was really interesting. I just had a question, and I'm not sure if it fits into sort of the scope that you're looking at, but are you taking into consideration sort of the stage of the pregnancy and prioritizing where there may be more complications during that stage, that it's more critical to make sure that you have connection to them?
That's a really great question. And Armand definitely considers the stage of pregnancy, both in terms of the information that they're transmitting and also the rate at which they're passing information. So for example, in the 1 week immediately following birth, they provide automated voice calls every single day instead of just twice weekly. Our approach is not specifically considering that at the moment, but certainly that is a factor that Armand uses when actually looking at the recommendations that our algorithm suggests and then deciding what to actually implement.
Any other short question while Kim prepares your slides?
Thanks a lot for the great talk. I had a question about possible like practical extensions or whether they're doing in practice. First of all, this is a worst case scenario, but is there a way to see whether people do take these calls or not to observe their response state? And the second, to observe whether they have been in this absorbing state of not responding for more than one time. So I think because it will make them less likely to switch.
Yeah, so we do have information about the historical engagement pattern, so we are able to observe that and account for that. We do treat this problem using a Markovian assumption, so just saying that their behavior depends only on the current state that they're in. But I agree with you that if we think about the kind of like history of engagement, that will probably give us more insight. But just for tractability and keeping the problem simple, we use this binary state for now.